Well, welcome back. You know, we continue to raise awareness for breast cancer today, talking about a surgery that's helping patients regain their sense of self. Here to explain breast reconstruction and options for patients is plastic surgeon Dr. Jessica Rose with UT Physicians, along with Monica Hindmarsh, who recently had a procedure done. Ladies, welcome to both of you. Thanks so much for being here.
Thank you for having us.
Dr. Rose, let me first start with you, and let's talk about reconstruction, because this is basically rebuilding of the breast after you discover there's breast cancer.
Correct.
And so are there different options or timing? Is it all kind of built into the same conversation?
Yeah, there's a lot of different options for patients. Part of it depends on what they need to treat their cancer. So there's smaller options for patients who are having a lumpectomy to help reconstruct that defect. But for most patients who are requiring mastectomy, there's basically two options. One is to reconstruct the breast with implants and tissue expanders, and the other option is to use their own tissue, usually taken from the abdomen.
And when we're talking about the actual reconstruction process, is it mostly done after treatment and after that cancer has been removed, or can you do some of these simultaneously?
It's usually done simultaneously. I try to do it at the same time that the breast surgeon is doing the mastectomy. Obviously, they have to finish the mastectomy first.
Right.
But it really just depends on what patient's cancer stage is, what other treatments they have, and what other medical problems they have. But if it can be done in a safe fashion at the same time as mastectomy, that's certainly most ideal.
And I know, you know, we've done so many stories, of course, this month during October, and there's so much that surrounds the diagnosis. There's a lot of conversation, there's a lot of doctor visits, there's a lot of scans and tests. And so when you think about what's being removed and taken away from you, and that being the breast, that sense of self and sense of normalcy after the cancer diagnosis, I think, helps a woman recover, right?
Absolutely.
Having that done. And so that's where Monica comes in, and we want to hear your story, because this is very interesting. You have a history of breast cancer in your family and also BRCA2 positive. So that diagnosis for you, once you went through that genetic testing, what was that moment like for you?
Well, since I had such a strong family history of cancer, it wasn't too surprising. But of course, it's scary when you're looking towards your future health risks.
And everybody should be tested if you have a history. You were saying your sister is negative, right?
She is.
Yeah, so it's really interesting how that breaks down. I guess that's another conversation for another day. But talk to us about your procedure and what you ended up doing once you found out you were BRCA positive.
Yeah, so I went and had consultations with several surgeons before I found Dr. Rose. And I had a double mastectomy, and then I had something called a deep flap surgery. So
and what is that? Is for people at home wondering exactly what that procedure is?
So deep flap is a microsurgical procedure. It's using the belly part that you would take off if you had a cosmetic tummy tuck, but we save the blood vessels and we reconnect everything up in the chest, and we use that tissue to form and shape a breast. And so you sort of get some of the benefits of having a tummy tuck, but it's your own tissue, so different than an implant. It ages with you, it changes with you, it changes with your body type, and it's a permanent part of you, and it feels like you.
That's really interesting. It's really incredible, that type of procedure. And so would that be considered to a partial reconstruction, or that's a full?
In most cases, it's done for a total mastectomy. There are certain instances where you could consider it if you had enough of a defect for a partial mastectomy defect, but there's smaller, easier to do operations with less of a donor site and a less of a healing process that can be done for those smaller defects.
And Monica, as far as like the healing process, I would imagine, you know, it obviously you just underwent surgery, so the healing is you know, normal.
Yeah.
But afterwards, you probably feel more normal, right?
I do. There are days that I forget that I've had surgery, and it's been less than a year. So yeah, when I look in the mirror, I don't always think that I just had a mastectomy and reconstruction.
Because it wasn't that long ago, right?
December last year, yeah.
That's awesome. Congratulations.
Thank you.
And that's the thing. Knowledge is power. And I think for you being able to share your story, and a lot of people don't really know what to do once they get that diagnosis. So for you, once you found Dr. Rose, it was easy, right?
It was much easier after I found Dr. Rose, yeah.
Yeah. What about insurance? How does that And I know each person obviously would, you know, you have to sit down with each person, but how does that work?
Yeah, so all these reconstructive procedures are that they're considered reconstructive and not cosmetic, and they're 100% covered by insurance companies. So in 1998, the Women's Health and Cancer Right Act was passed, and so it's actually illegal for an insurance company to deny breast reconstructive procedures. And that actually even includes saying you're having a mastectomy on one breast. It includes symmetry operations on the other breast to get everything matched and even.
Fantastic. And we did mention this a little bit, but recovery, of course, there's time and several weeks
yes.
involved, but
Yeah, so the recovery depends a lot on which operation you choose. With implants, it's usually a night in the hospital and then a few weeks at home. If you do what Monica did, it's several nights in the hospital, and it's about 6 or so weeks at home to really feel yourself, because it's really a big operation.
absolutely. Well, Monica, thanks so much for sharing your story. We do appreciate it. And Dr. Rose as well for the insight and information. And for more information for you, you can visit utphysicians.com or simply give them a call at 832-325-7181. Ladies, again, thank you.
Thank you for having us.
And coming up after the break, we're going to meet the Houston teacher making it big